Well, as world leaders prepare to gather in London for the first ever G8 summit on dementia, researchers say they've made a significant step towards eventually preventing Alzheimer's. Scientists at King's College London believe they're close to developing a blood test that could be used to detect the disease much earlier than now. In a moment, we'll hear from the author, Sir Terry Pratchett, who's been living with Alzheimer's for 6 years. First, though, here's our health and social care correspondent, Victoria MacDonald.
Deborah Gatesman remembers quite clearly the moment she was told her father had Alzheimer's disease.
Actually, my mum told me. I was on the phone. She rang me at work and told me over the phone, which seems incredibly insensitive, but I think she was so relieved that she needed to tell me, and I think for her it was an absolute milestone actually getting a diagnosis.
Relief is not the reaction you would expect, but it had taken James Gatesman's family 2 years to get that diagnosis, and that was 2 years of knowing that something was wrong, but of not being able to get any help, of not really understanding what was happening to the man they loved.
You are very slightly in denial. I suppose there was a bit of me that hoped the doctor was going to say it was something completely different, take this pill and go away and he'll be fine in a week. But of course, you know, that's not the truth.
And that is the problem with Alzheimer's and other dementias. There is currently no pill to take that will cure the disease. Diagnosis itself can, as with Mr. Gatesman, take years. And scientists now believe that the disease probably starts to develop more than 10 years before the clinical symptoms even appear. But there is growing optimism. Researchers here at King's College London have told Channel 4 News that they have made a significant step towards developing a blood test for the early detection of Alzheimer's. This would in turn be used in clinical trials for drugs to prevent the disease. It is rare that scientists use words like breakthrough. They're naturally cautious, but not in this instance.
We are nervous about claiming too many breakthroughs, but I think we are seeing in this study some very promising data, more promising than I've seen before.
Out of the thousands of proteins in our blood, Professor Lovestone's team has managed to identify 10 proteins which they believe are markers for Alzheimer's, which could be used to detect the disease long before the full clinical symptoms appear. And working in collaboration with scientists from across Europe, they have already recruited thousands of people to take part in a study.
We've developed a kit, we've developed an assay, and we need to, first of all, have very large numbers of participants or volunteers for this study. We've assembled, I think, probably the world's biggest group of volunteers for these kind of studies all over Europe. We're gathering at this moment all the blood samples from those individuals, and then we need to run this test through.
And so optimistic is Professor Lovestone, he's prepared to predict there will be a test within 5 years and a drug to prevent the disease within a decade. The project is being funded from one of the largest ever grants awarded by Alzheimer's Research UK. It is a blood test to be used in clinical trials only rather than for the general population, but there is hope it will one day be for wider use.
If we had a blood test for Alzheimer's disease, it would be far easier for people who thought they had some memory problems to get a very quick, a relatively uninvasive and a cheap test to determine whether or not they have Alzheimer's disease. And that would bring great relief to families, and also if unfortunately they are diagnosed with the disease, then it will enable them to get medication if appropriate, but also plan for the future as well.
This announcement comes ahead of next Wednesday's G8 Dementia Summit, which has been called by David Cameron. Health ministers, charities and drug companies will gather in London to discuss how they can collaborate on research and ensure there is proper funding. None of this will help Mr. Gatesman, of course. He's had Alzheimer's now for 10 years. But if the predictions are correct, it will benefit his children and his grandchildren.